Very, very lucky today to have Alexandria Papadimoulis. She's the education coordinator from the Regional Center for Poison Control and Prevention in Boston, and she covers Massachusetts and Rhode Island. So we're very lucky to have her here today and appreciate her being here with us to share some wonderful knowledge about poison control and prevention. Thank you, Alexandria.
Thank you for having me, and thank you all for coming today. So I'm Alexandria. I am the education coordinator at the Regional Center for Poison Control and Prevention. So today we're going to go over who we are at the Center of the Poison Control Center and what we do. There may be some information you already know about poison control, but there may also be new information that you are going to learn today. So in your packets, you actually have a bunch of information. We have the poison home safety checklist, so you can, after today's meeting, you can go home and go through the checklist to make sure that everything is in your house is poison free. There's also a poison center brochure, a tip handout, a sticker, magnifier for your medication, and there's also a sheet with additional resources that are going to be discussed throughout the presentation, so you have them for afterward. And there's also a note card in case you have any questions or concerns. You want to jot them down at the end. I can answer questions. And if we don't have any time, you can put down your email, your name, and I can email you back later. So first, we're going to talk about who we are and what we do. The Poison Control Center is a nonprofit organization that provides assistance, expertise, and in the medical diagnosis, management, and prevention of poisonings throughout Massachusetts and Rhode Island. We provide information for over 500,000 potential toxic products, interactions, and reactions with medications. We are part of the American Association for Poison Control Centers. There are 55 in the United States. We were the third established. Though we were founded at a children's hospital in 1955, we serve people of all ages, not just children. In 2000, we started serving Rhode Island, and today we cover a population of over 7 million. We offer two services. One is the educational outreach, which is what I'm doing here today, and the Poison Help Hotline. The Poison Help Hotline is a phone service which provides medical advice to callers who have experienced poison exposure, has a question about a potential poison, or has a question about medication or how something may affect the medication you're taking. It is a 24-hour-a-day, 7-day-a-week free service. It is handled by medical professionals such as nurses, pharmacists, toxicologists, and doctors. All calls are confidential. In addition to this, we offer interpreter services for 150 different languages. You can call the Poison Control Center if there's been a poisoning, if you are concerned about a potential poisoning, to ask a poison prevention question, ask a question about medication you're taking, or to ask for poison prevention material. In your bags that you have today, you have some of these poison prevention materials, such as brochures, stickers, and magnets to put around the house. And if you are interested in ordering materials, you can go to our website, maripoisoncenter.com, and you can order materials off there. In case of an emergency, you do not want to call the Poison Control Center, you want to call 911. So for instance, if someone stops breathing, collapses, or has a seizure, you want to call 911, not the Poison Control Center. So if a poisoning does occur, I'm going to reiterate one more time, and if someone collapses, stops breathing, or has a seizure, you want to call 911. Otherwise, you can call the Poison Hotline at 1-800-222-1222 for assistance. So when you have a phone call with either 911 or the Poison Hotline because someone ingested something, you want to make sure you have the victim's age and weight if possible, what they were exposed to, the amount if available, and when and where the exposure happened. And remain on the phone and follow the instructions of the emergency operator or the Poison Control Center. Does anyone here have any pets? Or know of someone who has a pet?
No, we don't have pets.
Okay, so say your friend Billy has a pet dog and Billy eats a chocolate bar and you don't know what to do. Who you can call is the Animal Poison Control Center at 1-888-426-4435. They are the number to call if an animal that you know ingests something. The Poison Control Center does not accept calls for this, and if you do call the Animal Poison Control Center, a constellation fee may apply, and that's normally around $65 per call. back to the Poison Control Center, we are a cost-saving mechanism. On average, the national bill to the emergency room can range from $1,200 to $2,200. And because 70% of the calls received at the Poison Control Center can be treated at the site of the exposure, so say at your home or at school, we help cut these costly hospital charges and prevent unnecessary visits to the emergency room. So does anyone here want to talk to me about what they think of when they think of a poison?
Well, I think of someone becoming very ill, long-lasting effects if they don't get the appropriate care and treatment.
So a poison can be anything. Anything can be poisonous when it is used in the wrong way, wrong amount, or by the wrong person. This can happen when by inhaling something, if something gets into your eye or contact through the skin, or by injection. Paracelsus, a Swiss alchemist and physician, once said, "Poison isn't everything, and no thing was ever poison. The dosage makes it either a poison or a remedy." So in other words, any substance can be harmful to an individual, but it can also have healing properties. Depending on how much you take, can make the amount, it a poison.
Right, the rat poisons, something, you take a little bit, then it is some good medicine.
Are you talking about waterfront?
Oh, warfarin.
Warfarin,
Sorry, it's from rat poison.
Yeah.
So now we're going to get into national poison data. So right now, poisoning is the #1 cause of injury, deaths in the United States. For every year, nearly 2.5 million poison exposures are reported, and each year, 177,000 adults aged 65 and up visit the ER for drug side effects. And these adults are 7 times more likely to be hospitalized as a result of one of these visits because doctors want to make sure that their heart rate and things go back to normal. So now we're going to focus more on Massachusetts. So in 2018, there were close to 33,000 exposures of all ages. 18 were fatal. Of these 18, half of them were for adults 50 years and older. So to break that down even more, we're going to look at this chart. So as you can see from this chart, while children are more often exposed to poisons, adults suffer from more serious poisonings, injuries, and deaths.
Do you include suicide?
Yes, it is included in here. So what is a medicine? Any substance or substances in treating or preventing a disease and illness is a medicine. So this can include prescription medications, over-the-counter medications, herbal remedies, and dietary supplements. Medications don't just come in pill form, they also come in the form of a patch, a powder, cream, drops, sprays, injectable liquids, and liquids you swallow. So can anyone here tell me what the most common cause of poisoning in adults is? Or take a guess?
Tobacco.
It's medication.
Yeah, I was gonna say.
So we're going to talk about why. And as of 2018, 3/4 of the exposure calls that the Poison Center had were for adults 60 years and older, and they were about medication errors. While older adults comprise of 13% of the United States population, 34% use prescription drugs, 30% use a non-prescription drug, and 87% of adults 65 and older take at least one prescription medication. And on average, the adults who are taking more than one medication, it's normally around 4 different types. And this is going to include prescription, over-the-counter, herbal remedies, and dietary supplements. So for the top poison exposures for ages 60 and above, we have 1, cardiovascular drugs, analgesics, which are also painkillers, sedatives, hypnotics, antipsychotics, antidepressants, and household cleaners. So how can you prevent a poisoning from occurring? We're about to dive in. So 1, you can participate. It's your health. You want to make sure you're as healthy as you can be. and try to prevent any poisonings from occurring to not only you, but people around you. So first, you want to use a legitimate source of health information. Your primary source of health information about your medication or any health problem you have should be your healthcare provider. This can be your doctor, your pharmacist, your nurse practitioner, whoever it is that you go to for your health needs. You can also call the Poison Control Center at 1-800-222-1222 for any questions you have for your medication. And if you obtain any information from the internet, you want to use a .org, .gov, or .edu because those are the most trusted websites. So you go to the doctors, they give you medication. Some sample questions you may want to ask. What is the name of my medication? Why am I taking this medication? What side effects could I have? How much do I take and how often? Should I take this medication before I eat, during, or after meals? What should I do if I miss a dose? And what should I avoid while taking the medication? Always read and follow the entire medicine label. This also includes over-the-counter medication, not just prescription. Make sure you know exactly how much medicine you should take and how often you should take it to make sure you don't take too much at one time. And you should also know whether you can take it with certain foods, beverages, or medications you should avoid while taking it. Make sure you also write down what your doctor's saying and keep a note, an up-to-date list of all the medications you are taking. This includes any prescriptions, any over-the-counters, any vitamins, any herbal supplements, or dietary supplements. And bring it with you whenever you go to a healthcare facility or a pharmacy, especially if you're taking more than one because it is easy to forget. And this way, when you go to the doctor, you can have a list, everything prepared so he knows what to change or what to add to your medication list. 4, to reduce any chance of another individual getting into your medication, make sure to keep your medication up and away and out of sight of not just children, but teenagers, other adult visitors, and pets. It's important to dispose of expired medications and ones that you are no longer using. This can help prevent mistakes and keep medicines out of the wrong hands. And 5, be prepared and know who to call. If it's not an emergency, don't hesitate to call the Poison Control Center. Again, it's confidential, it's free, and we're here to answer any questions, whether if it's about a poison or just a question you have about your medication. So now we're going to dive into some safety tips. So 1, review your medication with your medical professional. Don't use more medication than is prescribed, and never use someone else's medication. What may work for someone else may not necessarily work for you. It can either be too overdose and not help you at all, or it can be too much and cause you harm. Always compare active ingredients because you never know, maybe one medication has something and another has the same exact thing, so you're getting double the dose or more than you should. Always plan to refill your prescription so you always have the next day ready. Never take medication in the dark. Turn on the lights so you can see what you're taking. And properly dispose of expired and unused medications. There are multiple ways to do this. 1 is your community take-back days. They happen twice a year, once in April, once in October. The next one is actually October 26th. If you want more information, you can always call your pharmacist or your local police station. Next, we have drop-off boxes. There are 3 different kinds. Ones that happen at hospitals or pharmacies, and you can go to the DEA's website, which the note is located on your additional resources that's in your packet, and you just type in your zip code and it will give you a radius of what's in your area. Or you can go to the Mass Government website, and they have for police stations, and what you do is you just, again, type in your zip code and it will give you what police stations are near you where you can go and just drop off medications you no longer need. If you are doing an in-home disposal, what you want to do is you want to take your medication and put it in a bag with something people are unlikely to eat, so cat litter or coffee grinds. You want to tie it up and then you can throw it in the trash. There are some medications that can go down the toilet or through the sink. Those are listed, so if you look at the medication label, those will be listed on there and it will say, okay, this can go down the drain. And if you want more information on if you want more information on which medications can do this, you can go to the FDA's website, and again, the link is located on your additional resources. So when you're taking dietary supplements, herbal supplements, you want to take caution. There have been 1,500 documented interactions between drugs, herbal medicines, and dietary supplements. Natural is not necessarily safe, and just because a product claims to be natural doesn't mean it is. There could be, because the United States has different regulations in other countries, so if you order something online from, say, Mexico for some reason, and it gets shipped there, they may have different regulations, so there could be hidden metals and other hidden ingredients that may not show up on the ingredients list. And supplements can also change the way prescribed medication works for your body. So Medline Plus has a link online that lists dietary supplements, what they do for your health, and how they interact with other medications. Again, this link is listed on the additional references. And if you have any other questions, you can also, again, contact your doctor if you're going to take, say, peppermint and it may have an effect on your medication, or grapefruit juice. Or you can call the Poison Control Center so you can get at least multiple people telling you, okay, it's okay if you take this, or maybe slow down on drinking so much juice because it can have this effect on your medication. Now we're going to go through 3 scenarios. The first one is Joe. So Joe has been taking warfarin, a blood thinner, once a day for the past year. Some family history on Joe is that his father passed away from a heart attack at a young age. One day while watching television, Joe sees a commercial for a child aspirin and how it helps with heart disease. So hearing this and knowing his family history of his father passing away from a heart disease, he adds aspirin to his daily routine. Does anyone see a problem with what Joe did?
Well, he took it without talking to his doctor first.
One, he didn't talk to his doctor to see how it could affect his medication. Because since warfarin is a blood thinner and Advil is also a blood thinner, it can cause problems such as easy bruising, abnormal bleeding, and even a stroke. Scenario 2, meet Ellen. Ellen rides her bike daily and drinks grapefruit juice at breakfast. She feels healthy with a lot of energy. She goes in for her annual checkup. Everything's fine, but her doctor says, you know, Ellen, your cholesterol is looking a little too high. I'm going to prescribe you some cholesterol-lowering medication. So hearing this, Ellen takes her medication, and to stay even healthier, Ellen decides to keep drinking grapefruit juice in the morning and adds another glass at lunch. Does anyone see what a problem here could be?
You're not supposed to drink grapefruit juice with cholesterol.
So because she's drinking so much grapefruit juice, it's causing a buildup of medication, and this can lead to muscle problems. So scenario 3. Sara recently retired from her job with the city government after 30 years. She is enjoying her free time. She goes on hikes, she goes boating, and she spends time with her grandchildren. For her aches and pains, Sara takes a common pain reliever, acetaminophen, often. And then she develops a cold, so she starts taking a multi-symptom cough and cold medicine. Does anyone see what a problem here could be?
That one I don't know.
It may have some
Because
of
I
the
do the same,
It may have some of the Tylenol product that
cold
is in
cold
the,
medicine, yeah.
affect the liver.
So exactly. So Sarah's already taking acetaminophen for her daily aches and pains, and when she adds a multi-cold symptom medicine, this also has acetaminophen. And too much acetaminophen over a couple of days can cause liver damage. So now we're going to go into some ways you can help prevent poisonings happening to you or others. One is to have a pill box. This way you can have your week all set up, you know when you take your medicine, and you're good. You can also keep a journal of when you take your medicine, at like what time and how the amount. You can set an alarm to remind yourself when to take the medication. You can make a checklist. If you have a smartphone, you can go to the App Store and download apps that will tell you when to take your medicine, when to refill your medicine, and how much medication you have left so you're not lost. Next, products may look very similar, so you want to make sure you leave them in the original container. If, say, this Pine Sol and the Welch's fruit juice didn't have those labels on it, they look very similar. So someone could say, oh, this Pine Sol looks just like juice, exactly what I wanted right now, and end up getting poisoned. So for carbon monoxide poisoning, you want to have your furnace and heat systems inspected and serviced annually. Never use a grill or hibachi inside your home. Never operate a gas burning appliance in a closed space. And install carbon monoxide detectors, especially near sleeping areas. When you change your clocks back in the fall or spring, you just check your batteries to make sure that they're still fully charged or there's still some juice in there, and then just replace them every 5 years. Familiarize yourself with potential poison sites. Preventing poison is not just about getting poisonous substances out of your house, because that's just impossible. It's about taking the necessary precautions when it comes to using, storing, and disposing of household substances, and being prepared if the unthinkable happened. Does anyone here have grandchildren or nieces and nephews at a young age, or neighbors that come over that are young? So, child poisonings. Around 60,000 young children are brought to the emergency room each year for getting into medications that were left within reach. And grandparents are 4 times more likely than parents to keep prescription medications in easily accessed places because they take them more frequently. A recent study also showed that caregivers and parents are 80 times more likely to make a dosing error when giving medication to children. So a way to prevent this is if it's a liquid, don't ever use a teaspoon or a tablespoon. One, because they're all come in different shapes and sizes, so you don't actually know how much you're getting. So if you're gonna give medication in liquid form, use a syringe or a measuring cup, because then you know the exact amount you're giving someone. You want to keep your medications and cleaning products up and away from a child's reach, and use cabinet locks. But remember, there is no such thing as child-proof, only child-resistant. There is no substitution for adult supervision. So you want to make sure that you still keep an eye on the young ones, even if they are up and away. You can also use a lockbox. This is very beneficial because, 1, it locks. But also, children are, again, very curious. So if they see you taking things out and putting things in, they're going to really want to know what's in there. So again, just make sure you keep it up and away and out of the child's sight. So can anyone here, as you look at this picture right here, can you tell the difference between which one's a medication and which one is a candy? Probably not. They look very, very similar. So things to keep in mind is never refer to medication as candy, because if a child thinks you're eating candy, they're going to try their hardest to get the candy. Keep medication in their child-resistant packaging. Avoid using Ziploc bags or a container that can be easily opened by a child. Keep all medications and vitamins out of sight and out of a child's reach. And teach the child to ask adults for permission before eating or drinking anything. So to recap now, what we want to do is secure the child safety cap or packaging after every use. Put away potential hazards as soon as you're done using them. Follow the directions and labels when administering medication, and never mix household products together. Because when you mix something, you're going to get concoction, and you can inhale it, or it can get on you. It can cause a poisonous reaction. So right here is the poison control prevention phone number. You're more than welcome to take out your phone and plug it in now if you want to. If not, you again have it on your home safety checklist. You have it on your additional resources and some of the brochures that you have in your packet. And then I want to thank you all for coming in today again. And if you have any questions, just let me know, and I'll try to answer them best I can.
That was wonderful. Very thorough, wonderful, but yeah, questions?
Does anyone have any questions?
If something's just expired a month or so, is it still good to take?
So when medication expires, it is good to get rid of it, because the enzymes that are in the medications, they start to wither away over time. So it won't be as effective as before it expired.
It isn't poison, but it's still...
It's less effective, so you're not getting the exact dosage that's listed on it.
My mother, since I was a child, I used to come home to the smell of ammonia and bleach.
Okay.
And that combination, I heard, could kill you.
Yeah.
I can imagine.
It has killed people.
But,
And then my mother used to use talcum powder all the time. Shower to shower and baby powder. and now it's, can cause cancer.
Okay.
Talcum. But I noticed even, some makeups, like, well, even blush has the talcum in it. So I just, you get kind of frustrated on what to use and what not to use. But as far as, and then the Roundup on TV, and I remember coming into my granddaughter's, with my daughter, yard, and the dog was dead on the lawn.
Oh, wow.
So I don't know, people use all sorts of things. I don't know what the dog died of, but he happened to be working on the lawn at the time. And so you have to be kind of wary of what you put on to kill ants and to kill other things. You actually can kill your pet.
Yeah.
So I just thought I'd say that.
Yeah, you've got a lot of poison with you. It's always, if you have any questions or concerns, you can always call the Poison Control Center, or you can look online. But if you are looking online for information, say about Roundup or other chemicals like that, make sure you are using a .gov, .edu, or .org, because they're going to give you the most reliable information.
Yeah. I don't know if he was using Roundup, but I don't know, all the Roundup products are not taken off the market, but certain ones are taken off the market.
Yeah, I guess it may vary depending on which ones, but
Yeah.
again, it's important to always do your research and contact people who know more so you can learn as well.
You had mentioned too, that some cosmetic products can
Yes.
be,
There are, in some cases, there have been studies where Roundup will get into the runoff water, and in say in areas where they are spraying Roundup for farming to kill all of or even pesticides to kill all the bugs and the weeds, there are areas where they become cancer clusters because of the chemicals that are in there. They are carcinogens.
Yes, I was reading about living near a railroad track. I live near a railroad track. And because they're constantly spraying with pesticides, it seeps into the soil and then it seeps into the water system. And they found that, like my grandson, he developed type 1 diabetes at 7. And they were doing a study on whether those that he also lives near a train station, not in Concord though, and they were doing a study about diseases from people that live near the train station, and diabetes, juvenile diabetes was one of them.
Wow.
Yeah, because they constantly spraying on the railroad tracks, so. Yeah, so I can't prevent that.
Yeah.
But maybe I can, if it's, maybe we all can, if it's a problem.
Yeah. They all, also the chemicals in there are also endocrine disruptors, so it can change the way your hormones are produced. So that could also be maybe a reason why.
Yeah.
Does anyone else have any questions or comments? No? Well, thank you for sharing.
Okay.
And also the idea of the medications disposing, there are specific dates, and we actually had one here at the Council on Aging, but putting in the coffee gardens is something that you could do to dispose if you've just got a few medications, so it's great.
Awesome. Well, I
Well,
hope.
thank you so much, that was great.
Thank you for having me. I appreciate it.
Now, what about taking herbal products with medication? Like, that green tea extract, it's called L-T-A-G-N-I-E?
Yes.
To take with medication?
I don't know too much about green tea as much, so you can again call the Poison Control Center, or there is on the list, there is a website, I think it's Medline Plus, that has all herbal medications and supplements, so you can look online as well. Everything can also be different depending on who you are as a person, because your body processes things different.
Taking vitamins with, I suppose that's not gonna do any harm, no?
Yeah, you can always check. But
So is grapefruit juice the only juice that can affect some medications, or are there other fruit juices also?
it may be also what is in the fruit juice that is causing the reaction, but I know grapefruit juice is one of the big ones that has a lot of effects.
grapefruit juice.
Well, what about candles? I heard something about that candles can throw off some kind of poison.
I have not heard that, but I can look into it and get back to you. Yeah, I can get back to you on that one. It's a good question. Right. Anyone else?
And I think also too, always just check with your doctor because as you mentioned too, Alexandria, you don't know, there could be some interaction, some medication, something medically that's going on with you. So it's always really important to check with your doctor. What may affect someone else may not affect you. So that's always important. Yeah. Great, well, thank you so much. This was wonderful.
Thank you for having me.
Yeah, thank you.